last word.
Move to strike the last word. Okay. Mr. Chairman, I want to first say that, you know, I'm extremely grateful that we're doing this. I made mention of that earlier, but what we've seen happen across our country with the mental health crisis, it's devastating, and it's devastating across every socioeconomic group, across every age. There's not a demographic or a community that hasn't been touched by this. And I think in many regards, particularly with our younger population, both our teenagers and our youth, they've really been challenged in so many ways through the pandemic, and they tend to be more fragile at this point than maybe their predecessors have been. And so I'm thankful that we're focused on this. I'm grateful for the work that the Congress has done in a very bipartisan basis. But one of the things that I want to particularly talk about is HR 8910, Behavioral Health Integration Awareness Act, and been very proud to work with Jason Smith and Brad Snyder to introduce this bill. And it really aims to address a problem that's at the heart of this country's mental health crisis. And Behavioral Health Integration Awareness Act would require the Secretary to reach out and effectively communicate with physicians and other healthcare professionals who accept Medicare in order to inform and raise awareness of behavioral health integration services that are available to the patients. The goal of this bill is to increase the uptake. We've done a lot of work around the country on this, but we still need patients and physicians using the services. And this is going to increase, and I think if we're wise, we will look further down the road in additional legislation, because we are going to need not only an uptake of services that we have now, but we're going to need an increase in the number of providers. And I know that we have talked about that in this committee, and there have been some steps taken in other legislation to increase this. But not only do we need increased utilization, but we're going to need a significant number of providers going forward. And we're going to need to understand that this is going to have a lasting impact on healthcare. But anything that we can do for early intervention, early uptake, early treatment, I think is going to be important. So we think that this bill is an important tool in addressing the mental health crisis. And again, I encourage everyone to support this. And with that, Mr. Chairman, we'll yield back.
Thank the gentleman. Let me recognize the gentleman.